Good morning, everyone. It is so good for you all to be here this morning. Permit me at this point we are going to bow our heads and just ask the Lord's blessings. Just bow our heads where you are. Dear kind and heavenly Father, we want to thank you for waking us up this morning. We want to thank you for bringing us here safely, dear Father. The students this morning are a little nervous. Calm them, dear Father. And dear God, please help us to take us back on our way, those who are going back to their various workplaces and those of us who are going home later this afternoon. We thank you for all your blessings. This I ask in your precious name. Amen. Amen. Okay, at this point, I want to acknowledge the permanent secretary, Mrs. Nicole Slack from the Ministry of Health. I also want to acknowledge Mrs. Pamela Pemberton, the director of the Nevis Sixth Form. I will also like to acknowledge the nurses and the staff of the health unit, and Mrs. Hodge. She just walked in. She is the former PEO and also an educator at heart. I would also like to acknowledge students, teachers this morning. And we will just let the program flow, and we will have, first of all, we will hear from Mrs. Nicole Slack, Permanent Secretary in Slack Library, in the Ministry of Health, and then we will hear from Mrs. Pamela Pemberton, the Director of the Sixth Form. After that, we are going to hear from the students who will do the presentation. Thereafter, if there are any questions that you need to ask or anything that you need to be clarified, you may ask or state your statements at that point in time. I want to acknowledge also one of the faculty members of the Clarence Fitzroy Bryan College, Dr. Marissa O'Connor. She's right there. She was a member of she used to go to our school as well. So she's now a faculty member of the Clarence Fitzroy Bryan. So, Mrs. Slack.
Good morning to all, and I really appreciate this turnout, and thank you for inviting us here today. I would like to adopt the protocol already established. I would also like to recognize, however, some persons that would have come in after the acknowledgements: the Coordinator of Community Nursing Services, Ms. Genevieve Daniel, and the Public Health Nurse Managers. We have Deslyn Tyson White with us, also Ms. Ermin Jeffers, and also our matron at the Alexandra Hospital, Aldris Pemberton Diaz, our HIV/AIDS coordinator, Nadine Carty-Canes, and the rest of the health team and the education team, including students, faculty. Good morning. Chronic non-communicable diseases such as diabetes and hypertension represent the greatest burden of disease in the population. A 2007-2008 survey conducted in St. Kitts revealed that over 20% of those surveyed were hypertensive and approximately 80% were overweight or obese. The Ministry of Health recognizes the need for further research in this area, including the availability of data for the island of Nevis. We are therefore pleased to be here this morning as we witness the presentation of the findings of a diabetes research study conducted by the University of Virginia research team led by Dr. Janita Richardson and comprised of students from the University of Virginia, Clarence Fitzroy Bryan College, and the Nevis Sixth Form College. The data presented this morning will provide the Ministry of Health with strategic information related to the prevalence and distribution of type 2 diabetes in the population, and will also include data on the clinical management of persons with diabetes and hypertension who access care at 6 public health facilities on the island. It will also provide data on knowledge, attitudes, beliefs about diabetes in the general population. This data will assist us in the identification of gaps that exist in our diabetes prevention, care, and treatment programs, and allow for improvements in these services. This study is in tandem with the policy goal of the National Policy and Plan for Non-Communicable Diseases 2013 to 2017, which is to reduce the burden due to chronic non-communicable diseases by promoting healthy lifestyles, reducing the prevalence of common risk factors, and providing integrated, evidence-based treatment options to those diagnosed with non-communicable diseases in the most cost-effective way. It is important that we at the Ministry of Health generate interest in the field of research among our students. This will equip them with an advantage as they pursue further academic studies, as they are exposed to analytical skills, among others. It will also build capacity at the local level among our own citizens of St. Kitts and Nevis to be the lead investigators in health and other fields. We take the opportunity now to thank the student members of the team, which included Ms. Noelisa Swabi, Mr. Ajari Brown, Ms. Michelle Crawford, and Ms. Aisha Herbert. We also encourage students here this morning to apply for this opportunity next year, as it can only enhance your personal and professional development. Thank you.
Good morning, everyone.
Good morning.
Please allow me to adopt the protocol already established. It is with great pleasure and pride that I welcome all of you here this morning to listen to the findings of the research that was conducted in the Federation of St. Kitts and Nevis on type 2 diabetes. When Mrs. Janita Richardson visited us in the summer of 2014 to discuss the participation of our students in this project, we immediately welcomed the opportunity. As a matter of fact, we were elated, and we did all within our power to ensure that this happens. The students, a number of students applied, and they went through a rigorous selection process. The fortunate persons were Ms. Noelisa Swaby and Mr. Ajari Brown. They were selected from a group of equally capable students, but they were the fortunate few. And so we were very proud of them at that point in time. And we encouraged them to go ahead and participate, do what they needed to, because Mrs. Richardson, she indicated that one of her main objectives was to build capacity in the area of research and analysis of research in the Federation of St. Kitts and Nevis. And so we encouraged that opportunity for our students. At this moment, we look forward to the findings of the data to see what that would mean for our population. We also congratulate the students from St. Kitts who were selected to participate in that project. And we know that they all benefited. And we hope that the skills that they would have gathered and would have garnered doing this research project and the exposure that they gained will be put to good use to benefit the population of St. Kitts and Nevis in time to come. So again, we listen with eager ears to hear the findings of this research. Now, for me personally, diabetes has special implications because a number of members of my family have suffered from this illness, and so I'm anxious to find out more about how diabetes is affecting our population and what we can do to prevent and control diabetes in our population. So with this, and no further ado, I look forward to hearing the findings of the research.
So we are 4 members of the EMPERT group that did a study on the prevalence and distribution of type 2 diabetes in the Federation. My name is Noelisa Swaby.
My name is Aisha Herbert.
My name is Michelle Crawford.
My name is Ajari Brown.
We collected both qualitative and quantitative data, and in this segment of the presentation we'll be focusing on the qualitative data. We'll be focusing on the perceptions and knowledge of diabetes in St. Kitts and Nevis.
Here we have a model that we use, which was the health belief model in accordance with the Donabedian model, which we created a hybrid. It shows the perception and severity of the study, also the decisions to seek care and the process for seeking care in accordance with the providers like the health centers, the hospitals, support and education groups, and others. Our inclusion criteria and survey instruments, we included persons between the ages of 18 to 75, and we also use an instrument from the WHO Stepwise. This is a globally surveillance tool used for health risk, and that was adapted. We used part of our sections for this in relations to type 2 diabetes in regards to the risks and severities, and made some minor adjustments to our languages and pictures in consultation with the Ministry of Health.
Here is an excerpt from the WHO instrument that we use, and this section focused on the diet. And so we asked questions like how many servings of fruit they eat in a typical week. Next slide. And we needed to do some in-country adjustments to the WHO instrument so that it correlates with the culture of the Federation. So for example, instead of using fruits like peaches that they usually eat in America, we changed them to fruits like bananas and coconuts that correlate with the Federation.
For our procedure, what we did, we collected information from sites such as the supermarkets, the parking lots in certain areas, and we organized ourselves into groups of two. One was a local student, one with a US student. We did this for purposes such as our language and to increase the response from our individuals in regards to like our dialect. And we also wore our t-shirts. I'm certain that most of you would have seen us in either a white or yellow t-shirt, white or blue t-shirt with the global health sign on the back. And we approached persons that appeared to be over the age of 18. We described our study and we secured their oral consent. And we also asked the questions in the WHO STEP instrument and additional open-ended questions also. It took around 10 to 15 minutes to complete our study, and of course we thank our participants. And these are the additional questions that we asked.
Okay, for the survey, we divided the survey into different parts and analyzed them based on the questions that we asked. So the first part of the survey, we asked questions about their diet, like what they eat, fruits and vegetables. So approximately 60% of the respondents reported consuming fruits and vegetables 4 to 7 times per week. And this is a table that summarizes the information, the data that we collected using the 4 units of analysis, which were male, females, Nevis, and St. Kitts. This information shows the diet responses pertaining to adding salt to their food while they're cooking, eating processed food 3 to 4 days a week, and eating out 0 to 3 days a week. This was food they have not prepared at home. This table shows that information. So approximately 62% of our respondents add salt often or always to their food while cooking. 61% eat processed food sometimes or rarely, that's like 1 to 4 days a week. And 77% say they eat food that they have not prepared at home. That's like 0 to 3 days a week. This table shows that information that we have collected.
In this section of the survey, we focus on the physical activities at work. And based on the self-reports, 31% of all the respondents self-reported that they do vigorous activities at work for 4 to 7 days, and approximately 51% of the respondents reported that they do moderate activities at work for 4 to 7 days. Now, vigorous activities include those activities that cause you to breathe more heavily than normal, and your heart rate increases above normal. While moderate activities, you're breathing relatively normal, and you're able to speak. We also focused on leisurely physical activities, and these are activities that you may enjoy at home, not necessarily at work. And we focus on vigorous leisurely activities and moderate leisurely activities. And based on the self-report, 16% of the respondents reported that for 4 to 7 days they do vigorous leisurely activities, and 35% of the respondents they do 4 to 7 days they do moderate leisurely activities, and these are activities that are usually done at home. And here's a table that summarizes the findings.
Self-reported cases of diagnosed diabetes, hypertension, and high cholesterol. And approximately 13% of all the respondents stated that they had diabetes, and approximately 28% stated that they had hypertension, and 17% stated they had high cholesterol. We then looked at these numbers based on our research, and we looked at them with our comorbidities, hypertension and high cholesterol, and 51% of the diabetic cases stated that they had hypertension, and 33.3% of the cases stated that they had high cholesterol. And these are summarized in our table.
The summary of lifestyle responses for self-reported, you can see that there are 26% that were instructed by a clinician to reduce salt intake, and 38% were told to eat at least 5 servings of fruits and vegetables daily. 33% were told to reduce fat in their diet, and 42% were told to start doing more physical activity, and 50% were told to maintain or lose weight. And this is the unit of analysis showing the summary of the lifestyle responses.
Why do you think people have diabetes? And based on the Donabedian and the other model, I can't remember it now, we brought down the question under the theme perceived susceptibility and came up with the categories diet, genetics, exercise, weight, and don't know.
In the summary of metabolic screenings, you can see approximately that 51% of the recorded fasting blood sugars levels were high, and approximately 41% had a high blood pressure. 72% had a combined high cholesterol levels, and 14% had a high triglyceride level. And this was for the sample size, which was drawn from the chart review participants who were diagnosed with a type 2 diabetes in respect of our unit of analysis.
So here are the comorbidities, and based on our findings, we realized that out of the identified diabetics, approximately 27% had high cholesterol and 45.9% had high blood pressure. And this is the table that summarizes that information, dividing the patients into the 4 units of analysis.
The limitations for the chart review, the most important one was the legibility of the doctor's handwriting. This is an example of a chart review that we use all information, that all the person's information was removed so that they cannot be identified. As you can see, it is not legible. Recommendations that we made, based on the percentage of diabetic cases in the random sample, we recommend that particular attention be paid to the Charlestown Clinic. Also recommend diabetes prevention interventions targeting hypertensive patients in all clinics. We recommend that particular attention devoted to female patients who are hypertensive, diabetic, or at risk of diabetes, and those between the ages of 50 to 75. We also recommend specific health interventions for patients diagnosed with both hypertension and high cholesterol to better prevent diabetic cases.
Based on our community data from the survey and chart reviews, we believe that educational materials be targeted towards patients who are diagnosed with diabetes, in addition to hypertension, high cholesterol, or both. It will decrease the prevalence and help to manage existing cases.
Annual metabolic screenings related to diabetes mellitus, especially for those predisposed to the disease, can provide clearer evidence for reallocation of limited resources for prevention.
And due to the small amount of males that we reviewed in our sample, we believe that there should be targeted advertisement to the male population to increase utilization of the clinics on use.
Are changed because they're not convenient for the working adults. And as a result, we wonder if they can be changed So we believe that an adjustment to the clinical hours may be beneficial for the working population who may benefit screenings and chronic disease management. So here we come to the end of our presentation. Thank you for listening. So we are 4 members of the EMPERT group that did a study on the prevalence and distribution of type 2 diabetes in the Federation. My name is Noralisa Swaby.
My name is Aisha Herbert.
My name is Michelle Crawford.
My name is Ijari Brown. To the protocol already established. On behalf of my fellow colleagues, I would like to thank everyone who is instrumental in this joint effort between the Federation of St. Kitts and Nevis and the University of Virginia and EMHERT. Librad, the matron at the Alexandra Hospital, the managerial staff at the health clinics, Mrs. Pamela Pemberton for her brief party remarks and the early and continued involvement in the project. Thanks is given to Dr. Janita Richardson, our illustrious leader and mentor who kept us working hard to meet our deadlines. To our US team members, it was a pleasure working with you. We have learned so much and we have formed friends for life. The team would also like to publicly thank the workers at the health clinics who have been so patient and helpful during our time. And thank you to the Ministries of Health of both islands for allowing us these collaborations with our young people and the ministry. And thank you for allowing us to develop our research skills. Thanks.